Okay, today's topic is when IVF with donor eggs fails, what should I do? When IVF fails, what next? And today the presenter is Dr. Koutoulakis from IVF Serum fertility clinic in Greece. He is an obstetrician and gynecologist and fertility consultant and a clinical director of the mentioned clinic. Okay, I think we can start with the presentation.
Okay, I'm ready to start.
No problem. Okay.
First of all, my greetings to all of our friends all over the world. My name is Ioannis Koutoulakis and I'm gynecologist at Fertility Center IVF Serum in Athens. Today we're going to discuss on very interesting topic of what should we do when IVF with donor eggs fails. Before I go any further, I would like to make an introduction by saying human reproduction potential is limited even when the quality is optimal. Clinical pregnancy rate does not exceed 50 to 60% per attempt. That means a big piece of the cake related with a matter of luck. All other relevant factors need to be optimal as well: sperm, uterus, immune, and hormonological factors. Apart from the traditional approach of donor egg IVF treatment, as a clinic, we are looking into innovative techniques that would aim to restoring or even reversing fertility potential for the woman. This includes ovarian stem cell transplantations and egg freezing. Now, going back to the basics, let's have a look. What we need in order to achieve a full-term pregnancy? The answer is simple: good quality eggs, good sperm, and embryo-friendly and optimum endometrial cavity. All these three conditions need to be optimal at the same time. Now, it's a time to discuss about the quality and ovarian reserve. The ovarian reserve and the quality are affected from the maternal age. The quality decreases with the maternal age, which reflects into reduced clinical and ongoing pregnancy rates. Equality as well affected from except maternal age, from infections, from chronic inflammation disease like endometriosis, chronic health disease, some type of medication. Ways to investigate the ovarian reserve and the quality. The ways to investigate the ovarian reserve includes transvaginal scan, counting the antral follicles, hormonological panels like FSH and MH, previous fertility history, like previous pregnancies, and IVF treatments. IVF treatments are the best diagnostic procedure to investigate the quality. We can get a lot of information regarding the quality after the egg retrieval. Are there any ways to improve the quality? Of course, the answer is yes. First, using supplements as melatonin, folic acid, for example. A lot of supplements improve the quality, but we don't expect the miracle from the supplements. Of course, another way to improve the quality is the controlled stress and healthy life. And finally, treatment of endometriosis with some anti-inflammatory medications plus laparoscopy. All of these ways can give us better quality eggs. In cases where egg quality have diminished, the option of egg donation becomes a realistic alternative. Using egg donations ensure optimal quality. All the clinics should be used young and healthy egg donors, preferably with proven fertility. Sperm is the next. Spermatozoa carries the paternal DNA to the ovum, leading to the creation of embryos. High levels of DNA fragmentation in spermatozoa leading to embryos with abnormal DNA, which will translate to implantation failure or miscarriage. Diagnostic tools for sperm investigations are classic sperm tests, which give us details and information about the numbers of the spermatozoa, the morphology, motility of spermatozoa, and the presence of infection cells, which is index for infections. Sperm culture test, oxidation test, and finally the sperm antibodies test. What we can to improve the sperm quality? Simple as well. Healthy life, frequent ejaculations, using antibiotics, vitamins, and antioxidants. If everything else fails and if significant sperm issues are present, the sperm donations becomes a realistic option. Another important factor needs to be considered, and it is the histocompatibility issue. Sometimes male partner might share common antigens with female partner who will carry the pregnancy. This is accidental and can lead to implantation failure or miscarriage. Couples with unsuccessful treatments should be checked for this issue, though it is not very common. Ways we can investigate the histocompatibility issue is the D2A match test. If there is partial histocompatibility, this can be addressed by specific immunization. If there is complete histocompatibility issue, the only option is using donor egg, donor sperm, or surrogacy. Another important topic we can discuss is the hidden sperm issues. In some cases, despite the fact that all the sperm tests comes back normal, we still witness unsuccessful outcomes related with the sperm. In these cases, we attribute the diagnosis of exclusion, hidden sperm issue, we just confirmed following a successful sperm donation attempt. We suggest donor sperm if not successful treatment with not explanation. After the sperm, another important factor we have to investigate in women with egg donation as successful treatment is the uterine cavity. Uterine cavity is an important factor for achieving pregnancy. Microscopic and macroscopic disorders can cause unfriendly uterine environment for embryos to implant and grow. Macroscopic disorders which affect the endometrial cavity are first fibroids, some mucosal fibroids which project into the endometrial cavity, polyps, adhesions or scar tissue, and congenital uterine malformations, septum, bicornuate uterus. We have some investigation tools for these macroscopic disorders, as a single scan with not precise investigation tests for uterine cavity instead of ovarian reserve, aquascan or saline infusion sonography, which give us a lot of information about the situations inside the uterus. But the gold standard investigation test is the diagnostic hysteroscopy plus minus laparoscopy. The treatments for these macroscopic findings includes hysteroscopy or resectoscopy for fibroid removal if more than 30% of the fibroid projects into the cavity. Operative hysteroscopy for polyps, adhesions, or septum with laparoscopy, if needed. Microscopic findings in uterine cavity. The most common is the chronic intrauterine infection. You can think of the mechanism which uterine infections affect the environment, the uterine environment. The bacteria infections activate the local immune system and lead to increased NK cells. Bacteria as well secrete toxins which kill the embryos. As well, these toxins kill and the normal lining cells, lead to scar tissue and reduce the blood supply and lining thickness and quality. Investigation tests for these intrauterine infections are intrauterine biopsy or period bleeding test, and doing PCR in order to investigate the bacterial infections. Treatments for all of these infections are antibiotics and hysteroscopy with implantation cuts. Hysteroscopy with implantation cuts is a simple operative procedure. It's a gold standard procedure during which, under direct hysteroscopic vision, the uterine cavity is explored in details. Any lesions identified, treated, and small cuts are performed on the fundus of the uterus, aiming at improving implantation rates. Based on our experience, we have observed a 60 to 65 increased implantation rates after this procedure. We have also seen many cases after hysteroscopy with implantation cuts where women achieve pregnancy spontaneously in intermediate period following hysteroscopy, which clearly reflect the benefit of hysteroscopy and implantation cuts. Other microscopic issues are the immune issues, from endometriosis, which is chronic inflammation disease and bacteria infection, and can cause implantation failure. Immune issues can be identified with immune tests, like a Chicago test, and treated with protocol medications like steroids, IVIG, with pretreatments, protocols with some anti-inflammatory medications, and laparoscopy if the Chicago test gives us a sign of endometriosis for diagnostic and therapeutic reasons. In summary, the initial approach of infertile couple with unsuccessful outcome after egg donation treatment involves period bleeding test to exclude the uterine infections. If the test comes back negative, we recommend for an aqua scan for a detailed uterine cavity investigation. If the result comes back as a positive for bacterial infections, we recommend the woman for antibiotics protocol plus hysteroscopy to identify any uterine issues with implantation cuts. And for a husband or boyfriend, sperm improving protocol, and after then, detailed sperm test and DNA fermentation test. There are other tests we can recommend as immune test, thrombophilia test, karyotype test, if needed. After all of this full investigation, we designed the appropriate protocol for this. Of course, we need to keep in mind, if the first attempt with egg donation treatment is unsuccessful, given all the other tests are negative, in many cases, we will consider trying a different proven donor. This was the presentation. Thank you for your attention.
Okay, let's start with the questions and answers session. Okay.
Okay.
All right, we have a first question from Julie. I have had 5 own eggs IVFs, all failed, and 3 natural pregnancies, which have all ended in miscarriage. I have had many of the tests you mentioned at Serum, including 2 hysteroscopies and cysts in the UK. I have also tested positive for natural killer cells. What advice would you give?
As I have explained you before, 3 things have to be optimum. And in your case, you have to investigate their quality. After this 5 times ONX treatment, IVF treatment, unsuccessful ONX IVF treatment, and natural pregnancies, we expect that maybe have to investigate the egg quality first. And one of the important factors in your case is the sperm. I recommend you to have a sperm test and DNA fermentation test, because after these 3 natural miscarriages and 5 ONX unsuccessful treatment, I think the sperm factor has to exclude. The sperm issues have to exclude.
Okay, thank you. I still think that we have some sound issues, so I apologize for that. Okay, let's continue with the questions. After the webinar, we create a transcription with the questions and answers. So you'll be able to read the questions and answers on our website. So I hope that it will help. Let's try to make the most of today. I'm sorry once again if the sound is not perfect for you. Doctor, okay, can we do next question?
Yes.
Yes, okay. Should my husband forget diabetes medication and blood pressure medication before submitting a sperm sample? Can either affect the quality. His sperm tests have always been very good.
If he has forgotten the diabetes medication and blood pressure medication just for 1 or 2 days for a short period before provide the sperm sample, does not affect the results at all. But of course, the diabetes affects the sperm quality.
Okay, so it doesn't affect if it happens once. Fantastic, thank you. Next question from Dawn. 6 IVF, 7 transfers, good quality blastocysts, hatching blasts, and then no pregnancy. Had so many tests, thyroid problems. What do you advise? I never had implantation.
Of course, the thyroid problems can affect the implantation, and we aim to stable the thyroid function for first. Then we have to investigate, in your case, the cavity after this 7 unsuccesses, because we have explained that the endometrial cavity is an important factor for achieving pregnancy and for implantation. Another thing we have to investigate in this case is the sperm quality, because sometimes if we cannot see a positive outcome after 7 transfers of good quality blastocysts, the hidden sperm issues may be present and affect the implantation. Sperm test, DNA fragmentation, and good investigation for the cavity, for bacteria and microscopic findings.
Okay, thank you very much. Next question from Kate. I have had 3 IVF treatments using ICSI, using husband's sperm. Very little fertilization with 1 egg each time, except for 3rd treatment, which resulted in no fertilization. We then went for another IVF using ICSI, using donor sperm, but non-fertilized, saying egg issue. Now looking at donor eggs. I also have a thyroid problem. I never had implantation in any case. What is your opinion here?
In this case, the most important factor is the quality, because if we don't have fertilization on day 1, this reflects with the quality. Using the donor sperm, we expect the optimum donor sperm quality. We recommend for try donor eggs to see the difference, donor eggs treatment to see the difference in this case.
Okay, thank you. Next question from Kim. I'm currently taking the antibiotics advised by Serum. What supplements should me and my husband be taking? I was advised by Penny not to take DHEA.
About your husband, it's good to start taking antioxidant vitamins like vitamin C and vitamin E. And regarding the DHEA, we have some worries using the DHEAs. Due to the DHEAs, give us some it's a risk for cystic formation. I really agree with Ben's recommendation, trying to avoid using DHEA, as we have seen a lot of cases with cysts after using DHEAs.
Okay, thank you. I'm sorry, but we keep hearing some background noise on your side, so it's a bit distracting. Not able to hear well. Okay, next question.
Can you hear me better now?
Yeah, I think slightly better, yes,
Okay,
but there was some noise, like something was happening there. Okay, thank you. Can stress during the 2-week wait impact implantation? Can some foods positively help implantation?
Of course, the stress affects the outcomes of the implantation, and some then healthy life implantation can give us better results. But as we discussed before, we don't expect the miracle with a good quality of supplements and dietary.
Okay, thank you. Next question. 5 failed own egg cycles and 2 failed donor egg cycles. I'm already using immune treatment and have had implantation cuts now. Anything you can suggest next?
You may use a new donor egg treatment after the hysteroscopy with implantation cuts and the immune treatments. If the next treatment will end up as a negative outcome, we recommend for donor sperm treatment. That means donor embryos treatment, because sometimes after these own eggs unsuccessful treatments and donor egg unsuccessful treatments, the most important factors is the uterus. You have fixed the uterus with implantation cuts and using immune treatments, and if after this action we still have the same unsuccessful outcome, we strongly recommend using donor sperm the next time.
Okay, thank you. Next question from Andrea. What do you think of LIT therapy? Is there any other alternative? Perhaps for those viewers who are not familiar with the therapy, can you please explain in a few words what it is?
LIT therapy is a gold standard therapy for couple with recurrent miscarriages, and after the DQA match test, we check the histocompatibility issues for male and female. You will see that the matching they have partial matching of antigens. Then we recommend for a specific immunization, which the name is LIT therapy. We strongly recommend for couples with partial histocompatibility.
Okay. Thank you very much. Another
I have
long
lost
question.
Sorry?
Is everything okay? Yes?
I have lost my screen. Okay.
Is it? Can you see the next question? I will wait. It should be visible. I can see the next question. Please let me know if it's there.
No, I can't see the next page. The problem with the,
Can you see the window?
screen.
Can you see the webinar room?
I can't start now. The screen.
Okay,
Please, can you?
I will choose a short question this time. So you don't have to read the question. Okay. Do you recommend egg donor adoption? We have a question from a user.
Embryo adoption treatment.
Yes, embryo. Yes, I think that's what the user meant. Embryo adoption.
We recommend for embryo adoption treatment for couples who have tried with donor eggs treatment and more than 2 or 3 times with fully investigated uterine cavity without problems. In this case, we recommend going ahead with the donor eggs, donor sperm treatment. That means embryo adoption treatment, which have high success rate.
Thank you very much. What about your screen? Are you able to see now?
No, my screen is started.
So I suggest, you may want to close the window and log in again, but I'm not sure how much time it will take.
How many questions
we have a couple of more questions. Okay, I will choose another short one. Question from Kate. Regarding donor eggs, would you suggest using donor sperm or using 50-50 donor husband sperm to get better results?
We recommend for this 50-50 donor eggs, donor sperm, husband sperm treatment in couples who have tried with donor eggs treatment and husband sperm, and they have with the optimum uterine cavity, and the result comes back as a negative, have unsuccessful outcome. In this case, before go ahead to the donor embryos treatment, it's good for diagnostic reasons to try split the donor eggs, half with a husband sperm and half with a donor sperm, in order to check the difference of the embryo's progress. We recommend this treatment in case we suspect some hidden sperm issues.
Thank you very much. Okay. And next short question. Do you recommend exercise before embryo transfer with donor eggs?
Healthy life is also physical exercise, decrease the stress, relax, good diet, health diet. Every time is good for your general health, but as well for these fertility outcomes.
Okay, thank you. We have a question from Kim. Is Serum IVF, your clinic, closed the whole month of August?
Yes, we are closed from 27th of July and 26th of August.
Okay, thank you very much. So that's useful information for the patients. Okay. What's your view on having sex after the transfer, the embryo transfer?
My view in this question is try to avoid sex intercourse until the test day.
So the test day, you mean 2 weeks or?
Depending on the transfer. If it was day 3 transfer, and after 2 weeks. If it was blastocyst transfer, after 12 days.
Okay, 2 weeks or 12 days. Fantastic, yes. Thank you. Okay, let me check for more questions. Next question. I had 2 failed IVFs with my own eggs and donor sperm, and they failed with no implantation. What do you recommend? I am 38 years old and AFC was around 12.
Okay, in this case, in order for achieving a pregnancy, we need three things to be optimal. The first is the egg. In that case, the age of 38 is still a promising age group because we expect about 25 to 30% positive outcomes. The only we can do in this case is change the protocols and find the more appropriate protocol for this lady depending on the scan results and the AFC. Second thing is the sperm. Using donor sperm, we expect that the quality will be optimum. And the third thing is about the cavity. It's good to investigate the cavity and exclude the bacteria infection. And depending on the results, it's good to investigate the cavity with the aquascan or with the stereoscopy if needed. That means readjust the protocol depending on the age group, on the hormone status, and the andra follicle count, which be 12. It's a very good number for this age group. And second thing, properly investigation for the cavity.
Thank you very much. Next question from Jillian. I've had 2 fresh IVFs and 2 frozen embryo transfers. Do you think donor eggs is the best option for me?
I don't know more details about this case. 2 fresh IVF cycles and 2 frozen transfers.
And 2 frozen, yes, exactly.
Yes, that does not mean that the only option is the donor eggs. Of course, the donor eggs treatment is the most promising option, but all related with the quality as well with the sperm and the uterine cavity conditions. If the uterus and the sperm are good, another thing we can do is readjust again the treatment, the IVF stimulation protocol, and try 1 more time or 2 more times, depending on the age group. If the age are more than 40, the most promising option is using donor eggs.
Thank you very much. Jillian, if you would like more information from the doctor, you can email us and submit more information.
Yes,
and I hope the doctor will be happy to answer later on, yes, because we need more information to answer. Okay, let's check for next question. Question from Kate. Like many patients, I get very stressed during the whole IVF process. What would your clinic suggest to reduce stress? My previous consultant suggests reflexology. Would this be suitable prior to treatment?
In our clinic, for the couples who suffer from stress during the IVF protocols, we recommend for acupuncture, which we have seen improve outcomes, ladies with high stress after the acupuncture, and as well we recommend for enjoy their life, have hobbies, arrange a visit around in our islands to enjoy the Greek sunshine. Try to enjoy the rest of the life and don't focus to the IVF treatment.
Okay, thank you. Question about your success rates. For donor egg IVF, how do you compare with other clinics in Greece, like New Life, in terms of successful pregnancy?
I don't like to compare our success rates with other clinics. Our success rate using donor eggs and a good quality sperm or donor sperm is about 50 to 60%. Around, I think the last success rate was around 57%. If the cavity is optimal and using donor sperm or good quality sperm.
Okay, thank you. So we have another question connected to that. What is your success rate for 40 and 42-year-olds in your clinic for donor eggs plus donor sperm? Is it the same?
It's the same. It's about 50 to 60%.
50 to 60%.
Yes. Combination with hysteroscopy with implantation cuts, the rates increase to 60-65% using donor eggs in all of age group.
Thank you. Next question from Jane. Donor eggs 4AA, great, 5-day blastocyst transferred, but no implantation, never got pregnant. Did blood clotting tests, but had normal result. What test shall I do next before the next fat transfer, frozen transfer?
It's very good as we have already the embryos and we cannot change donors or egg quality. It's good to focus to the uterine cavity, do the request for period bleeding test in order to investigate bacterial infection and arrange as well aquascan or hysteroscopy for full investigation of the uterine cavity. If the bacterial infection comes back positive as well, it's good to arrange an immune test like a Chicago test to check about the NK cells, about the immune panel of this woman, and design the appropriate treatment before starting the preparation protocol for the lining. Like if you have any suspicions for endometriosis, you could start taking a pre-treatment for 2 weeks with some anti-inflammatory medication plus some steroids in order to suppress the chronic inflammation which goes from the endometriosis.
Thank you very much. Next question from Nolene.
Of course, a clot.
Oh yeah, sorry. Okay.
The clotting test comes back as normal. That's the reason we don't need to recommend for blood thinner. Okay. Of course, the blood thinner is not needed, but sometimes it's good to use a blood thinner during the protocol because the blood thinner helps to increase the blood supply of the lining and protect for clots in ladies more than 40 years old who are on high dosage of estrogens in order for good preparation, lining preparation.
Thank you. Another question. What is the stem cell treatment you can offer? I'm 42, had 1 pregnancy after 9 failed cycles. Just tried for a sibling and had another failed cycle. The feedback is my eggs are poor quality due to my age. Would this stem cell treatment help me with own eggs cycle?
The autologous ovarian stem cells transplantation treatment is an innovative treatment we have started, but it's still experimental. We have seen some good outcomes, either to hormone status or to antral follicle counts, but we have to wait until we have more results in the future. Egg donation is, in this case, sometimes is most promising option at the moment.
Thank you very much. Question from Daniela. Does weight matter with donor eggs success?
Of course, the weight is it's an important factor for our outcomes. But we don't recommend our patients to lose a lot of weight before IVF treatments. It's good to change hobbies like the diet, start exercise, but we don't recommend for losing excess weight before starting the treatment, because we think that have side effects on the ovarian stimulation.
Okay, so is it because it's too big, too quick a change to the body, probably
Yes,
to the organism?
Yes,
okay,
yes.
To hormones.
And the hypothesis in the brain gets stressed after this change of the losing of this excess weight.
Okay, thank you. Next question. Can gluten intolerance affect the results of IVF?
Gluten intolerance, of course, affects the outcome of IVF. As we know, the glucose tolerance or insulin resistance disease affect the egg quality and as well affect the implantation. In this case, if we have patients with women with a problem with insulin tolerance, we recommend for a low glucose index diet and metformin for at least 2 to 6 months before starting the treatments in order to balance the glucose levels and the insulin levels in the body.
Thank you very much. I think we have answered all the questions. Let me check if there are any more questions. Yes, we have one more. I only have 2 4AA blastocysts left. I'm 42 years old. So the next frozen embryo transfer, shall I do single or double transfer? What do you recommend?
We recommend for double transfer due to
I'm
the
sorry,
age
I
group.
think we couldn't hear you. What you said, which?
We recommend for double transfer both of the embryos, blastocysts. Due to the age group, we don't expect all the eggs have to be optimal. That's the reason with double transfer we expect better chances.
Okay, thank you.
But of course, it will be great to adjust to investigate the cavity before arrange the next frozen transfer, just in case to be sure that everything is optimal before go ahead with the next transfer.
Okay, this is just a comment by Julie, who asked the question before. She had a couple of failed IVF cycles. And the comment is that they have had sperm tests and fragmentation tests, which have been all okay. And I believe you have already answered that question, or perhaps you wish to add anything?
Cavity and echo quality. If the sperm test and DNA fragmentation is good, we focus in this case for cavity, about the microscopic findings like bacteria, and focus as well to the quality. The quality related with age and the ovarian reserve.
Thank you. Are there any more questions? I think these are all the questions we have had. Okay. Yes.
Yes. In conclusion, my last note for our attendance. Let's focus not only to the egg. Of course, the donation in ladies with unsuccessful treatments is an option, but of course we have to investigate properly the cavity and the sperm. Does not only the egg give us the pregnancy. The pregnancy, for achieving pregnancy, 3 things have to be optimal: egg, sperm, and cavity. This is the meaning from us, the message.
Doctor, we have 3 more questions, so I think if you can answer those 3, that would be perfect. Yes. Okay. The previous question was about gluten intolerance, not glucose tolerance. I think Dr. Ioannis misheard. Oh, okay. I'm sorry. Maybe, okay, we didn't hear each other well. Okay, so it's about gluten intolerance.
Gluten intolerance, of course, affects the egg quality. And it's good, ladies with gluten intolerance, try before starting any IVF treatment, try diet with gluten-free.
Okay, so that's important. Thank you very much. Question from Claire. If uterine problems were established, How long would
Yes.
it take to go on to treatment once they had been treated?
Depending on the problem. If just additions or just a scar tissue, it's good to leave 1 month for a rest and uterine recover, and then go ahead with the next period after the hysteroscopy. If the problem is more severe, like septum or fibroid, it's good to leave 1 to 3 months before starting the new treatment.
Okay, thank you. Next question. I'm about to start my first donor egg cycle. I had hysteroscopy in February with implantation cuts. Will the cuts still last?
The cuts last for 6 to 8 months, at least. Sometimes it will last for a year. If more than a year, it's good to arrange an aqua scan with a scratch in order to refresh the cuts, or another hysteroscopy with implantation cuts if we have seen, if needed, if we have seen from the first hysteroscopy that a lot of scar tissue or septum. It's good to investigate again in a year with a second loop hysteroscopy or an aqua scan, just to confirm the uterine condition again.
Thank you. Question from Jillian. With regards to my earlier question of two fresh and two frozen transfers, okay, this is this additional information.
Yes.
I'm 37 with AMH of 10.11, sperm sample
Yes.
normal, also my CRP is 18.
The age group of 37, the age of 37 is promising age. Okay, we expect very good outcomes in this age group, and I think in this case it's good to focus to the uterus and sperm.
Okay, that's good advice for the patient. Question from Rimak. Does the blood type affect the... Oh, sorry.
All the attendants, all the patients can send us an email with the detailed history, and we will answer as soon as possible.
Yes, thank you. Does the blood type affect? Does the blood type affect if different than my egg donor? Okay.
No, does not affect the outcome at all.
Yes. There is no blood in the egg cell, right? That's why. Okay, I have a question about embryo adoption. Do you recommend it? I do not mean embryo donation.
Embryo donation is the same with embryo adoption treatment.
Yes, and I think you have answered. Embryo adoption is recommended for patients with poor
ovaries and bad quality and problem with the sperm.
Okay, there are two more people typing questions.
About the previous question, I don't know if this woman mentioned about the difference between frozen embryo adoption and fresh double donation treatment, which is different because frozen embryo adoption, we use two frozen excellent quality blastocysts with a fresh donor eggs donor sperm treatment, donor embryos treatment. We use fresh double donation blastocysts, and maybe we have more embryos for freezing, not only two, depending on the number of the eggs we retrieve from the donor, plus the quality of the donor sperm. Sometimes we have 4 or 5 blastocysts from a donor sperm treatment. Instead of embryo adoption treatment, we have only 2 frozen, excellent quality blastocysts.
Thank you. We have one more question. Can repeated hysteroscopies cause scar tissue?
Hysteroscopy cannot cause any scar tissue. Hysteroscopy is with implantation cuts to fix the scar tissue. because with hysteroscopy we do just superficial injuries of the lining, and we don't interrupt the basic line, which can cause scar tissue. The most common cause of scar tissue is the bacterial infection, which kill as well the normal lining cells and lead to death, and then a lot of dead cells can produce this scar tissue which cover the healthy lining. And with hysteroscopy and implantation cuts, we remove all of this scar tissue and help the lining to rebuild again healthy.
Okay, I think maybe two last questions and we can finish our webinar. Okay, question from AS. I've read on the internet that children born from IVF treatment may have difficult health issues, especially when they get older. Is this true?
IVF children, in rare cases, relate with some problems, but there are no evidence about this. Just a few.
Yes, I think it's a very popular question among patients, and a question that has been already asked during many of our webinars, and I must say that the doctors agree on the answer, that the answer is the same. Okay. Okay, that's it. I think we have answered all the questions so far. If you have any more questions, you can email them to me at dorothy@ivfmedia.org. That's dorothy@ivfmedia.org, and I'll be happy to forward them to Dr. Ioannis. You can also get in touch with the clinic via the clinic profile on our website. Dr. Ioannis, thank you very much for the presentation. Thank you very much for answering.
Thank you for the attention.
No
Sorry
problem.
for the delay due to this problem with the connection, but definitely we get through.
Yes, we apologize for the sound issues. If you are not able to hear everything, the video recording will be up on our website, and we will publish the answers to the questions as well. Also, I would like to thank all participants. We realize that IVF is a very emotional journey, and especially IVF failure is a difficult time for you. And we are very happy that you joined us to learn more about IVF failure. I wish you all the best and success in your treatment. And good night, everyone. Thank you very much, Doctor.
I wish as well good luck to all of our participants. Thank you for attention.
Thank you very much.
Good night. Bye-bye.
Good night. Bye.